The topic for today is acute like tropical illness. So diagnostic and the management and the challenges. So this topic itself is like it's diagnosis and the management is like most important. So because we see the most of the like mortality, and also it's kind of a diagnostic and the dilemma in like few of the patients like for us. So approach to tropical illness is entirely different topic. So but I try to cover at least for the like first 5 minutes, so how to approach for this acute or tropical illness, and then we'll go ahead with all the most common like tropical illness, like what we find in our in the practice. So my talk and goes like this. So incidents always like tropical illness. Indian data is like most important. So in the last decade, because see, these are the what the tropical illness which actually changes their paradigm with respect to the globalization. So if at all, if we have heavy rainfall in one of the areas of the country, so there we can actually see a different in the tropical illness. So it all depends. So the every decade, the mortality, the incidence, the morbidity, it keeps changing with the tropical illness. It will not be the same with all the diseases of the like, tropical infection. And challenges, no, what exactly we face and the challenges being an intensivist with intensive with tropical illness and leptospirosis and the scrub typhus, typhoid fever, different scenarios. Because like, we all know from the first year or the second year MBBS time, when we started under studying about the typhoid, it's only like fever and the loose stool. So there are actually different the classical presentations of the typhoid like fever, which we actually miss in our like practice. So dengue and the warning signs and the management and malaria. So and the overall management of the tropical infection. So coming to this, the approach, which is a only slide which I'm going to tell you guys about the approach for like a tropical infection. The one is the acute undifferentiated fever. So if at all, if I take this as 1 second. Yeah. So yeah, this can be divided into acute undifferentiated like fever and fever with like a rash or a thrombocytopenia, fever with ARDS, and acute febrile encephalopathy, and the fever with like multi-organ dysfunction. So though we have all this kind of the categories, when we are in a like multi-speciality centers in the tertiary care centers, we most of the time, so we get this the fifth, the pattern of the disease varies like fever with like multi-organ dysfunction. So the most of the patients they roam around all the like smaller centers, and when they step into like multi-organ failure, so they come back to us. So most of the time, so we see the patients with the fever with like a multi-organ dysfunction. So our first differential diagnosis should be like bacterial sepsis, malaria, scrub typhus, and leptospirosis, and dengue, and also hepatitis. And with all this, so the macrophage activation syndrome is not a tropical illness, but it is kind of illness like where because of the immunological and the reaction with like a tropical bugs, so the body immunity like will form antibodies, and it leads to like a macrophage activation syndrome. So though the like primary disorder is for tropical infection, but they actually land up with like macrophage activation syndrome. So, and the second most common, so which we come across is the fever with IRDS. Okay, acute onset like fever with the respiratory and the distress in the form of the hypoxia and the PF ratios of less than like 200. So in them, so the fever with ARDS, so we always think of like pneumonia, viral pneumonia, H1N1, and the COVID and all that now. So, but apart from that, so if at all, if you think that there is some amount of other organ involvements like going on, like thrombocytopenia, the liver dysfunction, and like mild AKI, so we might have to think out of the box and think about like scrub typhus and diffuse alveolar hemorrhage, which are the complications of a tropical infection, the secondary to tropical infections. Okay, so the fever with rash. So my the policies. So if at all, if I see the patients with like fever with ARDS, in spite of like doing all the required ventilatory and the strategies, if the still hypoxia is now persisting, if the and the lung shadows are still persisting on X-ray, the most common thing and what I think is diffuse alveolar hemorrhage. So you might have to do like a bronchoscopy and take the repeated samples and then see whether it is diffuse alveolar hemorrhage secondary to some immunological conditions or any connective tissue disorders, or secondary to and the tropical infections. And the fever with rash and the thrombocytopenia, which is also like a most commonly seen, but the patients like don't come with like such a severe illness, but they have some kind of diffuse generalized edema and thrombocytopenia. So the most commonly we come across is dengue and the rickettsial infections, meningococcal infections, and the malaria, leptospirosis like measles, rubella, all that. So undifferentiated fever, the fever of unknown and origin. So in that, all this comes up like a scrub typhus and the leptospirosis, dengue, malaria. So the reason like why I'm telling is, see, whenever you see some kind of like syndrome with like a febrile illness, so you should know like what you're going to treat. Though the treatment part for all these are, it's almost the same with doxycycline or azithromycin or the ceftriaxone and all that. But until unless and we should know the like a spectrum of the disease, how it goes, how the organ involvement is like going on, and defervescence. So what is defervescence? Sometimes, so we have sent all the blood samples for all the investigations, but like tropical infections in the workup comes as negative, but still the patient is actually responding to the doxycycline or azithromycin. So that means there is some tropical illness is like going on. It is showing some response to uh, treatment. So it is defervescence. It actually tells us that, okay, fine. So we are going in the right step. So if at all, if doing this kind of a differential diagnosis for a patient who comes with like a syndrome of a tropical illness, it is always good that, so we'll be in a safer zone. At least the patient like will not deteriorate like further. And last but not the least, acute febrile encephalopathy, acute encephalitic syndrome. So the most of the time, so we actually think that like a patient coming with some like fever and hypoxia and also some amount of an altered sensorium. So we might think an altered sensorium is because of hypoxia or because of an organ injury, but like we might actually miss so that there is some involvement of the cerebrum or the like spinal cord and all that. So we should have a low threshold to think of encephalitis, HSV, Japanese B enterovirus. So we had one the recent scenario. I'll tell you guys about that in the successive slides. Okay. So coming to the Indian data. So coming to the Indian data. So this is from the CMC Vellore. So the tropical infection the unit, so they have done their experience in the tertiary care hospital. So where they have done, I think it's almost around like 5 to 6 years of like a study, which is actually what published in 2010. So the final diagnosis of like 398 like patients based on the diagnostic criteria, they had like a mortality of around 11%. So, but if you see here, the highest number of the cases was actually the scrub typhus, and then comes like malaria, and then enteric fever, the dengue fever, and leptospirosis. So this was before 2010. So if you see here, sorry, yeah. So this is before 2010. So the before 2010 in this part of the area, like where they have done a study, it is like more of a scrub typhus and malaria and enteric fever. So, but if you see with the next slide, so where there is the study on the clinical like, profile of acute undifferentiated and the febrile illness in the tertiary care hospital, like where they have taken 2018 to 19. Here it comes is the dengue. The dengue has got the highest, though this undifferentiated has got highest percentage. But if you take with all these, the confirmed data, the dengue becomes the highest. So in every decade, so there is the changeover of this tropical illness. So we should be mindful enough to see these kind of like patients to have a low threshold to screen for all the tropical infections. So next comes like why we face and there's so many challenges in the tropical diseases. And though we know that this, we know the disease spectrum, so we know the like, treatment, so we know and what sample to be sent for to confirm the diagnosis. But the clinical disease profile is overlapping with other febrile illness. Other febrile illnesses in the sense and the viral flu, or can be UTI infections or any abscess inside in the solid organ injuries. They may actually present with like same kind of syndrome. Okay, so but and the classical symptoms masked by use of the medications. These are the patients who actually neglect in the beginning that they had only fever. So they take some like, paracetamol or some antibiotics in the outside. So once they feel that, okay, so they're going into the organ failure, so they visit some like smaller centers, they can get admitted there, and then they come to like bigger centers. So the most of the classical symptoms are like masked by use of the medications. So in these patients, it's very difficult to like put them into under which spectrum, like a tropical infection or some other infection. So and third is the most of the tropical diseases to be treated on empirical treatment. Yeah. So what I meant was in the earlier defervescence. So empirically, and we should like start the patient on doxycycline or the ceftriaxone and see the response, and then so we might have to think that like a patient had somewhat a tropical infection, so they might have come to us and late, or we might have like missed the diagnosis in the beginning, or and most of this and diagnostic and the tests are actually and the less sensitive and specificity. So we'll come across with all the diseases and late presentation. So they mask the tropical disease and land up in the bacterial infection. Because most of the time, so these, if I give you examples with some of the like what the typhoid fever initially, so they might have acute GE kind of symptoms, and the later on, so they might go into like a bacterial infections in the sense. So they might have, and the typhoon got and loaded inside the and the colon, and they can have intestinal obstruction, and they'll end up in bacterial infections. So these are different kind of like challenges like what we come across in intensive care units. And mortality with a single organ injury is only 10 to 15%. But along with a single organ injury, if at all if it is like a majorly involving the lung and the liver, the respiratory and the liver, so then the mortality is around 55 to 60%. So which is the really alarming for all of us.